Which of the following is a disadvantage of using cardiopulmonary bypass during non-cardiac surgeries? A. Increased surgical precision. B. Prolonged recovery from anesthesia. C. Reduced blood loss during surgery. D. Enhanced tissue oxygenation. Answer: B. Prolonged recovery from anesthesia. Explanation: a potential disadvantage of using cardiopulmonary bypass in non-cardiac surgeries is that it can contribute to a prolonged recovery from anesthesia. The systemic inflammatory response, hypothermia, if used, and changes in organ function associated with CPB can all delay the patient's return to baseline levels of consciousness and physical function. Which of the following statements is true regarding the use of cardiopulmonary bypass during liver transplantation? A. CPB is used in all liver transplants for better surgical exposure. B. CPB is rarely required in liver transplantation. C. CPB improves liver regeneration post-transplant. D. CPB is primarily used to control bleeding during liver transplantation. Answer: B. CPB is rarely required in liver transplantation. Explanation: in liver transplantation, cardiopulmonary bypass is rarely required. However, it may be used in some cases when significant hemodynamic instability is anticipated, such as in the presence of major bleeding or circulatory collapse. Most liver transplants are conducted without CPB, as the liver can be perfused and transplanted without the need for bypass. What is the role of antifibrinolytic agents in surgeries using cardiopulmonary bypass for non-cardiac procedures? A. To promote clot formation in the bypass circuit. B. To prevent excessive blood loss due to fibrinolysis. C. To inhibit platelet aggregation during surgery. D. To reduce the inflammatory response to the bypass circuit. Answer: B. To prevent excessive blood loss due to fibrinolysis. Explanation: antifibrinolytic agents, such as tranexamic acid or aminocaproic acid, are used in surgeries involving CPB to prevent excessive blood loss caused by fibrinolysis, the breakdown of blood clots. These agents help stabilize clot formation and reduce bleeding, which is a common concern in surgeries with prolonged CPB support. What is the most important factor to consider when choosing a cardiopulmonary bypass machine for non-cardiac surgery? A. The type of anesthesia used. B. The expected duration of the surgery. C. The patient's cardiac output. D. The availability of skilled personnel to operate the machine. Answer: B. The expected duration of the surgery. Explanation: the most important factor when choosing a cardiopulmonary bypass machine for non-cardiac surgery is the expected duration of the surgery. Longer surgeries typically require a more robust and reliable bypass machine to ensure sustained and safe circulation. Additionally, the type of surgery, the patient's condition, and the anticipated level of complexity can influence machine choice. What is the primary goal of monitoring perfusion pressure during cardiopulmonary bypass in non-cardiac surgeries? A. To prevent cerebral ischemia. B. To minimize blood loss. C. To increase oxygen delivery to tissues. D. To prevent myocardial infarction. Answer: A. To prevent cerebral ischemia. Explanation: the primary goal of monitoring perfusion pressure during CPB is to prevent cerebral ischemia, which can occur if the brain is inadequately perfused during the procedure. Adequate perfusion pressure ensures that the brain and other vital organs receive enough oxygenated blood during surgery. In non-cardiac surgery, the use of cardiopulmonary bypass may be required when A. The patient has severe preoperative hypertension. B. The procedure involves significant manipulation of the heart or great vessels. C. The patient is unable to tolerate general anesthesia. D. The surgery is anticipated to last more than 8 hours. Answer: B. The procedure involves significant manipulation of the heart or great vessels. Explanation: cardiopulmonary bypass is most often used in non-cardiac surgeries when the procedure requires direct manipulation of the heart, great vessels, or other vital structures that may necessitate temporarily bypassing heart and lung functions. This allows the surgeon to operate in a controlled, bloodless environment while maintaining adequate perfusion and oxygenation. During non-cardiac surgery with cardiopulmonary bypass, what is the role of the bypass circuit's oxygenator? A. To regulate body temperature. B. To provide oxygenation and remove carbon dioxide from the blood. C. To filter and remove waste products from the blood. D. To maintain the blood pH balance. Answer: B. To provide oxygenation and remove carbon dioxide from the blood. Explanation: the oxygenator in the bypass circuit plays a critical role in ensuring the blood remains oxygenated and free from excess carbon dioxide during cardiopulmonary bypass. It functions similarly to the lungs by oxygenating the blood and removing carbon dioxide when the lungs cannot perform this function due to the surgery. Which of the following is a potential cause of hemodilution during cardiopulmonary bypass in non-cardiac surgeries? A. Excessive fluid replacement after blood loss. B. The use of a bypass machine with a high oxygenator volume. C. Administration of vasoconstrictors to increase blood pressure. D. Inadequate anticoagulation leading to clot formation. Answer: B. The use of a bypass machine with a high oxygenator volume. Explanation: hemodilution can occur during cardiopulmonary bypass due to the large volume of fluids used in the bypass circuit, particularly the oxygenator, which can dilute the patient's blood. This dilution can affect the hematocrit and lead to a reduced concentration of red blood cells, which in turn can impair oxygen delivery to tissues. What is the primary concern when performing a non-cardiac surgery with cardiopulmonary bypass in an elderly patient? A. Increased likelihood of a stroke. B. Increased sensitivity to anesthetic agents. C. Decreased renal function and fluid balance issues. D. Increased risk of bleeding due to anticoagulation therapy. Answer: C. Decreased renal function and fluid balance issues. Explanation: elderly patients often have compromised renal function and may have difficulty maintaining fluid balance during surgery. This is a significant concern during cardiopulmonary bypass, as decreased renal perfusion and the inflammatory response to CPB can exacerbate renal dysfunction. Close monitoring of fluid and renal function is essential in this population. Which of the following is a key factor in preventing neurological complications during cardiopulmonary bypass in non-cardiac surgery? A. Maintaining stable arterial blood pressure. B. Maintaining body temperature at hypothermic levels. C. Ensuring complete anticoagulation of the blood. D. Using a higher concentration of oxygen during bypass. Answer: A. Maintaining stable arterial blood pressure. Explanation: stable arterial blood pressure is essential to prevent neurological complications such as stroke or cerebral ischemia during CPB. Fluctuations in blood pressure can compromise cerebral perfusion, leading to ischemic events. Maintaining optimal perfusion pressure and blood flow is crucial for protecting the brain and other organs during the procedure.